SBAR is an acronym used for documenting and reporting communication between the client and the other members of the healthcare team relating to the client's condition. SBAR stands for S, situation, B, background, A, assessment, and R, recommendation. Although SBAR is the most frequently used format, other forms exist like ISBAR or ISBAR, and that is with two R's at the end instead of just the one. The I for ISBAR usually stands for identity/introduction, which that would take away from the situation part and put the person's name and date of birth and the location at the time in the identity section. And the last R would stand for readback of orders or response. The communication technique of the SBAR allows the client condition to be well communicated and easy to understand throughout the healthcare team. The SBAR is crucial for successful teamwork and allows the team to run smoothly. The SBAR is also used in handoffs, which is when a client is released from one care to another care depending on their status. This allows easy communication and catches the new nurses of this client to get up to speed on their status, situation, and care. As previously stated, the S in SBAR stands for situation. The Taylor Fundamentals of Nursing textbook states in Chapter 19, page 474, that the S portion communicates what is occurring and why the patient is being handed off to another department or unit. This means that the S portion will include the client's actual problem. Some scenarios might include their code status, a set of vitals, their name, and their location at the current time.
In SBAR, B stands for background. The background section in this assessment tool provides essential information to a healthcare team that is related to a given situation. The information provided should be only relevant to that current situation and nothing else. This may include diagnoses, medical history, dates, medication info, or names of physician and nurses involved. Basically, anything that's relevant and provides the healthcare team the correct information to help their patient will be accepted. Here's an example that will demonstrate background. An 83-year-old woman has a history of severe bladder infections and an indwelling catheter. Her body temperature is now 102 degrees and her urine is foul-smelling and cloudy. In the past, a high temperature was signaled for an infection. Her catheter was changed 2 weeks ago and she was given Tylenol every 4 hours throughout the night. She presents as increasingly more confused. Now, this is a good example of background because it lists things like findings during an assessment as well as previous medical history of the patient.
SBAR. The S stands for situation, the B stands for background, the A stands for assessment, and the R stands for recommendation. And now I'll be talking about the assessment part. For the assessment part, the nurse will assess the patient's problem and what they found or what they think that the problem may be. For an example, the patient has a respiratory problem, the patient seems to have a cardiac problem, or the patient has an infection. But not all the time will the nurse know what the problem is, so in that case, the nurse could say, I'm not sure what the problem is, but the patient is deteriorating, which means becoming progressively worse. Or the nurse could say, I don't know what is wrong with the patient, but I am getting worried, we need to do something. In the assessment stage, the nurse should also explain what has been done already and if it has made the patient's condition any better.
The last part of the SBAR documentation process is R, which stands for recommendation. In this step, we are asking ourselves, what is the next step in the care for our patient? Here we finalize our treatment plan, inform staff about what tasks need continued or followed up with, and ensure our patient has everything they need. This step focuses more on our leadership role as a nurse, and it is our job to advocate for the patient if we see any changes that need addressed. The purpose of SBAR is to facilitate appropriate communication between patients, healthcare providers, and the families. The 4 parts of SBAR help prevent mistakes or breakdowns in verbal and written communication and help work towards safer healthcare for our patients.